like there will be expiry date. So waiting also reduce on a physical count.
This is 200.
200. These are issue 100.
So that
Out for use.
exactly. So each line now one transaction it increase.
Jhpiego is one of our partners, and they are supporting us with last mile distribution of essential commodities to health facilities. So basically, Jhpiego is supporting 5 districts: Putloko, Koinadu, and Kaine, 3 from the north and 2 from the south, which is Bo and Pujong. So basically, their support is to help us distribute medicines and medical supplies to these 5 districts. And basically, the essence of this particular stock verification exercise is for us to see how best colleagues are doing their job at the district level, and how best our 3PLs, that is our third-party transporter, are executing their duties. Because as partner supporting the Ministry of Health, they also want to ensure that there is value for money till the last mile.
The team, we are the supply chain team, which comprises of the DLO, the DIO, the district pharmacies, the CIMA, and other supporting staff. We all work together to make sure we put data together. That data they inform me on how we allocate medicines into facility. And then of course we work with other partners, for example for integrated World Vision and they support last mile, and then for free healthcare USAID to Jhpiego, and we make sure we do what we call virtual picking when from the M supply, and then that virtual picking they give you the picking list so they use for pack for facilities. After that day we can call upon the 3PL who they can hire either by partners and sometimes even government for move the commodities into facility.
This clinic they serve the community marvelous because waiting do, and this clinic I did between 4 sections: the Moria section, Rufenka section, Potekes, and Old Putloko section. They in between. I've been getting the book, but I don't know how to go about her. But I tell God thank you when I visit. You don't help me a lot. You don't learn. So any I can boast now for say anything now, any problem with interfere with supply, we know waiting for do.
Mangi CHC they cover 11,646 people there. Police facility in a CHC and also cover as a BEMOC center when a basic emergency obstetrics care. Well, this they always tell we who's we there, and the one that we come we also happy because they are our mentor there. Who's we get gap, the mentor we there, and who's we do well, then praise we there. This shows say if you then come, we they continue for learn more, and we also know who's we there in level, and who's for supposed for improve.
I think it's not a good thing for making me come and verify. We know government is send drugs, supplies, and other commodities throughout the year, and these drugs which can come in large quantity, they need to be verified by external person, because so that for supports we own verification, so they do.
Sometimes, finally we self the evaluate we self. Finally we get external, evaluators. I don't get them complaints them, because they get them full, waiting due them commodities and then you get them. But again, how do we escalate them? Sometimes I'm afraid, so such independent evaluation are really in place.
I think it's a very good exercise because it's going to guide us, it's going to direct us, it will give you information as to how the work has been going on. You look at the matrix, whether the commodities that were assigned to particular PHUs as per the matrix were delivered. So if that one is being done, and then you cross-check. That, you know, it shows that kind of accountability in the process.
The success story is colleagues are actually sending the medicine down at the facility, and basically also the facility knows what to do when they receive these medicines, and we wanted to see whether the documentation, the recording process is maintained, and we went through their documentations and also the storage of these medicines, whether the storage conditions are well in place. And there were one or two challenges in terms of one or two facilities on how they record their product as well, but we also provide guidance.
Message you are the same. This process, let improve some of who compete them. Sometimes you know they will get this opportunity when we get today. Let them self get this opportunity. So let awareness be there to we all.
One be regular, because when you be regular, it help we for long with ace with tentacle for always push before. And this they also help for sure say, like for example, if the DMS send drugs will not come, when they can able verify, like the verification when they do so is very important. And this they show they create a way that the DMS themselves for do the needful, while we self for continue for do the documentation and also request on waiting or come.
This exercise is very much important because if we don't have support to send these commodities to the district and to the last mile in the communities, if we don't have those support, the product will sit in our stores and they will get expired, and we will not have people will not have access to medicines, because the first important thing is to get the commodities available, and the next is accessibility, which Jhpiego is supporting NMSA to ensure. So basically it is very vital, and we want to thank Jhpiego and we want to ask that we need more of this support to ensure that commodities reach the last mile.